I request everyone to please keep the videos on. So at the outset, I welcome you all to our today's webinar, and which is done on a topic today being the Cancer Day, World Cancer Day. We thought to organize this topic for various reasons, and let me tell you, this is the second program after our newly elected president, Mr. Devendra Deshpande, has taken the charge of the institute as the president. I would say, in fact, we were discussing with honorable doctors who are joining the panel today. We have a very good panel made out today. We have Dr. Diwan, who holds around 35-40 years of experience under his belt. Dr. Shoaib also has around 20 years of experience. Dr. Priya will be joining a bit late, and Dr. Gauri, who is a holistic nutritionist, who would be sharing the other side of the treatment as to how one can reverse cancer as well. But let me share why we thought of organizing this webinar. I'm sure our members would be wondering. You would have seen us organizing programs on insolvency, company law, GST. How this triggered to us. As you all may know, we recently lost on 15th one of our very, very dear elected sitting council member, very young, 43 years of age. Whenever I talk about him, it's difficult for me to talk honestly. Mr. Deepak Khetan, he was such a dear brother, and we lost him only because of cancer. And I remember while we were having various condolences from our members, in between, I read a message on one of the groups by one of our other members, Sharda Madam from Bangalore. And she sent a detailed message instead of just sending the condolences. She sent a message that cancer primarily is caused because of the excessive generation of cells in the body, which is generally caused because of stress, obesity, and sleep deficit. And somehow I read and I sent her a personal message back. Dr. Diwan, you would be interested to hear this. I sent her a message back, personal message, that I am very happy to read this message. Or everybody is giving condolences, but you are guiding us. And I mentioned that I hardly sleep. In fact, for the last 2, 3, 4 days, I have not slept myself. Now, for the last 3 days here, I have not slept more than 10, 12 hours together, all put together. I have another webinar today. I had 2 hearings in the morning. And I sent her a message back that I hardly sleep and I'm certainly going through a sleep deficit period. And then she spoke to me. She called me back. She spoke to me. She said, I am a cancer survivor. She is herself a cancer survivor. She has survived, defeated this disease. And then I read about this. And then we discussed that we must organize some webinar. Before I could discuss this with our president and vice president, our president came out with this idea to organize this webinar today, and then I shared with him that we and me and Sharda madam were discussing, and I'm sure why. Let me tell you, our president also got this idea because very unfortunately our president lost his father because of cancer only, and that too in this month itself. In the beginning of this last month, in January beginning, that's how our president couldn't come to convention. He was the vice president, and around 3-4 months back, I remember president called me up. NPS needs some help, maybe at Patanjali, maybe at other places, if we can speak to some doctors. And I sent Deepak Bhai's reports to Dr. Diwan also earlier. And I think Satvinder sir sent Devendra Bhai's father's report to Dr. Diwan also, because we know Dr. Diwan personally. And that's how, that's again very, very unfortunate. Somehow we all were praying that our beloved father of our president could see him on this chair, could see him, our president, rising up to the apex position. And let me tell you, our president comes from a very, very modest family, very humble background. The kind of effort and hard work which beloved father of our president had put in to make him whatever he is today. I'm sure he is hearing this from heavens, and I firmly believe nobody goes from here because of 2 demises so close to us. This idea came to our president's mind to create awareness. So when 10 minutes back, Dr. Zaidi, I just finished my hearing, changed my blazer. At 1:45, I sent a message to Alka ma'am that we'll start sharp at 1. I'll join at sharp at 1. I'm finishing a hearing in NCLT, and I then said, yeah, I must know something about cancer, although I know it because I lost my grandfather because of cancer, my father-in-law because of cancer, lung cancer, and he got treated at that time in Gurgaon many years back, 6 years back, and we lost him. So, but now I thought I'll read about the Cancer Day, and then I realized, Dr. Diwan, that this concept is actually need of the hour, to create awareness about cancer, to create awareness about prevention, early detection, treatment. 10 million people die each year because of cancer, which is expected to rise up to 13 million. And this number is much more than collaborative total number of HIV, malaria, TB, and few other diseases as well. But I'm not threatening anybody. We have already seen that this disease has taken many people from us, but certainly if treated properly, if prevented properly, if the awareness is created, 1/3 can be prevented. If detected early, another 1/3 can be treated properly. And if resources are appropriately strategized, then we can certainly save millions of lives. And for doing that, today we are fortunately having a very, very luminary panel with us. And the panel which we have Dr. A.K. Diwan from Rajiv Gandhi Cancer Hospital. I'll give a detailed introduction bit later when I request Dr. Diwan to give his address. Dr. Zaidi, who comes from, again, an oncologist. Dr. Diwan is also a leading oncologist and director of surgical oncology at Rajiv Gandhi Cancer Institute. Dr. Zaidi is also an oncologist and comes from a robotics specialist background. He is known to be a robotics specialist, and he also has around 20 years of experience with him. He is presently with Apollo Hospital. Then we have Dr. Priya Tiwari, who will be joining a bit late from Artemis Hospital. And fourth again was suggested by Sharda ji, Dr. Gauri. She joins us from Bangalore, who will give us the different side from as to how holistically we can reverse and treat this disease. Certainly we are not increasing your fear. Certainly we are not increasing the threat. We are trying to reduce the fear. We'll have to increase the understanding. We'll have to dispel the myths. We'll have to dispel the misconceptions and change the behavior and attitudes. Before I request Dr. Diwan to give his address, I would request our President, Mr. Deshpande, for his presidential address. Unfortunately, our Vice President, my dear brother, Mr. Manish Gupta, couldn't join, and he has conveyed his best wishes for the success of this program. Over to you, President, sir.
Thank you, NPS. Thank you very much, and really touched with the background which you have already said. But I think the main purpose of creating this awareness about the cancer is the main aim of this particular program. I have gone through this entire process, and I must say that there are a lot of misconceptions about it. People are not aware whether we should go to an oncologist, whether we should go to an oncosurgeon, whether we should go to neurologist, whether we should go to neurosurgeon. What are the differences between all these doctors? Even a professional person like us, company secretaries, they are not aware about it. Secondly, the worst part about all this, going through this cancer related thing, may it be prevention, may it be detection, may it be cure, the Google plays a very difficult part in this. We go on search engines, read so many things, and actually we get bogged down with the readings which may not be authenticate ones. So there are few articles which may not be authenticated by anyone. They have just put it in some forum. So I thought that let's have experts of this particular field. Let them tell us that what is the real scenario about this cancer. And I could not find a better day rather than the World Cancer Day to have this particular program. I must thank NPS also, because he has NPS Chawla also, and along with Satwinder ji. He has arranged everything, and he just told me that this is the idea and let's work it out. And I must thank all the doctors. I know we all are waiting to hear them, and they are tremendously busy, and their every word is very, very important for us, not only for us as professionals, but some unfortunate event which may happen with our family members, close friend, close family members. So let's hear from them. I will stop myself here, and I know that this is going to be a good awareness for entire profession, members, students, and their family members. So NPS, over to you. I personally thank on behalf of Institute all the doctors for sparing their valuable time here, and let's explore that how we can fight this disease. Thank you.
Thank you, President. Thank you for giving this introduction and your address. Friends, now I'll request Dr. A.K. Diwan, who is a leading oncologist. He has earlier worked before joining Rajiv Gandhi Cancer Institute. He has also worked with Tata Memorial Hospital and Safdarjung Hospital. Dr. Diwan's specialization is in head and neck cancer surgery and also in breast cancer surgery. And friends, let me tell you, we feel very proud if we appear in 3, 4, 5, 7 hearings in a day. I have seen many senior advocates appearing in 5, 7, 10 hearings in a day, maximum 5 hearings I've seen. And myself, I've appeared in 2, 3 hearings, like if we appear before different tribunals. But when I read Dr. Diwan's profile, I was amazed to see the kind of mammoth work which he is doing. So he on a average basis, he's been doing around 120 major surgeries and around 100 minor surgeries every month, which means around 7, 8, 10 maybe surgeries every day. And 18,000 surgeries, more than it, Dr. Diwan has done so far in his career. And his experience is almost of our age. He is also the chief editor of the magazine being published by the hospital. I really love Dr. Diwan's motto, which is to treat. He says that Dr. Diwan would love to treat my patient as I would want myself to be treated and care with passion. He has already been awarded with many awards, and their achievements list is long, and he's also been awarded as a top doctor by DMA. I can say that when I spoke to Dr. Diwan and I gave him brief of our institute and this program, Dr. Diwan said, yes, I can certainly speak. I'll have to take out time. He's so busy. You can see he's still in hospital wearing his mask. And hats off to the doctors, what they have done, always for us. But certainly in the last 2, 3 years, we have known and recognized the importance of doctors. We can just say that, Jahan pana tusi great ho. We can just bow down before you. I generally bow down before when we enter the courtroom, but really you deserve this respect and regard more than anybody else. You are God sent people for all of us. Dr. Diwan, over to you.
Good afternoon.
Afternoon, sir.
Just let me share my slides. Can you see all this? Can you see the slides?
Yes, sir. We can see, sir. Okay. So if I can request you to do the slide share.
Okay.
From here. So if you see on the right hand side below, sir.
Can you see the slides now?
So we can see the slides, but okay. if you will press that slide presentation, it will be shown a bit bigger, and we'll be able to read that.
I have put it on my computer. It is seen as full screen.
Okay.
You're not able to see?
No, we can see that, sir. We can see.
Okay. Okay.
Please go.
So, I'll just start with a small story, which is a true story. And when I was in school, small kid, I had a genius school friend who used to have supari at the age of 12 years. We all wondered why. Beautiful girl, she started smoking when she entered college. And she was super intelligent girl. She chose commerce. We went into science stream. and she became a successful senior executive in an MNC, but became a night owl. Night owl मतलब कि रात भर काम करना है और दोपहर को 4 घंटे सोना है. That is a night owl. Got married little late, but never started family life. Never had children. Gained a lot of weight. Always glued to computer. No exercise, but busy throughout the day and night. Became very successful CEO of a company. Often enjoyed junk food, non-vegetarian diet, and daru at night, parties, meetings. Believed in free sex. जब भी मिले तो यही कहेंगे कि टेंशन बड़ी है यार, टाइम नहीं है. Can you see the slides?
Sir, we can only see the first slide. Welcome ICSI. It's not moving forward. Now
Hello.
Yes, sir. Now it's gone out. Like you'll have to maybe screen share again, sir.
Screen share again. But can you hear? This is okay.
Absolutely.
I can carry on like this.
Absolutely, sir.
Okay.
Yeah. You can carry this way, or if you can, if there's somebody assisting you,
not
you can
coming.
do the screen share.
Full is not coming. She owned a 5-bedroom palatial house, and everybody used to say Sarva Gunna Sampan. Was Sarva Gun Sampan. She started Supari at the age of 12 years, started smoking early, became a night owl, never started family life, gained weight, no exercise, enjoyed junk food, non-vegetarian diet, alcohol, and free sex. All qualities of being a Cancerian. At the age of 48 years, she got breast cancer. And then, of course, she went abroad. At the age of 55, she developed lung cancer, second cancer. And the rest is all history. She is no more today with us. So I thought it appropriate to talk about this incident. And today happens to be 4th February, World Cancer Day. Why is it important to talk about cancer? All of you have enumerated that so and so lost life, your own family members suffered from this. And I think today there's no family where people have not seen or people have not suffered this dreadful disease. And if you have seen Times of India today, there is a photograph which I have captured few lines from there. There are new cancer cases per year, 13.2 lakhs. Cancer deaths per year, 8.5 lakhs. Risk of dying from cancer before the age of 75 is 10.4%. Means 10% of us will die from cancer. And risk of developing cancer is 10% and risk of dying from cancer is 7.1%. And top male cancers are oral cancer, lung cancer, stomach, and food pipe cancer. And top female cancers are breast, followed by cervix, followed by uterus, ovary, oral, and then colorectal. One thing which is quite striking in male cancers, oral, lung, they are all lifestyle related cancers and they can be prevented. They are preventable tragedies. And female cancers, breast, cervix, to some extent even the other cancers, they can be detected early and virtually cured if you treat them early. So now the question comes, what causes cancer? People talk of, say, genetics, कि मेरे family में उसको है, मेरे दादा को है, मेरे mother को हो गया, मेरे को इसको हो गया. But I can tell you, genetics plays a limited role. About 7% of the cases are genetically acquired, and 15% of them are familial. Familial means कि आप सेम एटमॉस्फेयर में रह रहे हो, सेम चीज खाना खा रहे हो, सेम लाइफस्टाइल है, तो देन यू आर प्रोन. You may be genetically dissimilar, but familial tendency is there. But more than 85%, 80% of the cancers are acquired and lifestyle related. They are called environmental. Tobacco, pollution, diet, obesity, sedentary lifestyles, and so on and so forth. List is long. I will take up few of them one by one. WHO estimates that annually nearly 5 million people are killed by tobacco-related illnesses, and it is projected that by 2030, 8 million people will be killed by this tobacco-related illnesses. And it is estimated that in India, 2,500 people die every day due to tobacco. And 275 million tobacco users are there in India. And 35% of the population actually uses tobacco after the age of 15. And tobacco contains about 4,000 chemicals. And 40 to 50 of them are considered to be carcinogens. Carcinogens means cancer-producing substances. I will not go into the details of cancer-producing substances, but they are costly and quite dangerous. So what are the health consequences of tobacco? Is not only just cancer. There are other problems related to tobacco use. It affects your heart, causes hypertension, cholesterol disorders. There is something like peripheral vascular disease. People develop black limbs. Black means gangrene, सड़ जाती हैं limbs. और इतनी पेनफुल होती है यंग एज में, 20s की एज. These people are more prone to develop bronchitis, chest infections. If ladies are smoking, or a man is smoking in the house, and lady, of course, gets second-hand smoke, they are prone to have low birth weight children, premature babies. Even the children in the same house will have chronic chest infections, throat infection, and it can affect any organ, skin, tooth, fertility, eyes, ears, bones, you name the organ and it gets involved. And you must have seen the tanned teeth of people who chew tobacco. They have tendency to develop white patches in the mouth. They are unable to open mouth, especially people who use gutka, supari, allowed by Government of India, because gutka is considered as a food product, but I can tell you this is more damaging, and it causes inability to open mouth, which is called trismus or a submucous fibrosis. And high percentage of these submucous fibrosis people who are using gutka or supari, they are prone to develop oral cancers. People can develop cancer of cheek, gums, tongue. Of course, there is effect on gums and teeth. What is there in the tobacco that you get glued to it, you can't leave it? You see, it has got two components. One is nicotine. The other is other chemical. Nicotine gives you addiction, and the other chemicals actually damage your body. Whenever a smoker takes a cigarette, inhales, within 10 seconds, nicotine reaches his brain. and brain gets stimulated, and there are two chemicals which are released. One is dopamine, which gives you good feeling. आपने सुना होगा जो सिगरेट पीने वाले हैं वो बीच बीच में तलब होती है, उनको बाहर निकलते हैं, ऑफिस से बाहर निकलेंगे तो स्मोकिंग जोन में जाएंगे एंड दे गेट ए गुड फीलिंग विद स्मोक. And the second chemical which is released is noradrenaline, which makes you alert, may give you some energy. Okay. So remember, it is the nicotine which is giving you addiction. I asked one of the patients actually who is the owner of some big tobacco industry. I said, how does tobacco benefit? He was very honest in saying that, you see, we give revenue, we give employment, but smokers never become old because they die young. So the average lifespan of a smoker is 8 to 10 years less than the non-smoker. Alcohol, our friends, especially the cardiology friends and some of the physicians say that alcohol 1 or 2 packs a day is allowed. I strongly disagree with that alcohol is allowed. I can tell you that tobacco and alcohol is a deadly combination. And even ethanol consumption, that is alcohol, can cause various types of cancer, and it is linked to about 13 cancers of the body. I will not go into the details of how alcohol can cause cancer, but cancer of the mouth, throat, voice box, liver, breast, lung, all can, alcohol can be attributed. I'm sure someone is going to talk about, or Gauri is going to talk about diet and cancer, but just a few words that diet which is low in fruits and vegetables have been implicated in cancers of mouth, cancers of voice box, cancers of food pipe. And fruits and vegetables actually contain phytochemicals which protect you against cancer. You are company secretaries, and I'm sure most of you may not be taking regularly food. You yourself admitted that you have not been able to take sleep. In last 3-4 days, you must have slept for maybe 3-4 hours a day. And I'm sure you must be taking irregular diet and junk food most of the time. Junk food actually is high calorie but poor nutrient food. And it is not only cancer. You are predisposed to develop obesity, heart diseases, diabetes, and so many other problems. I compare the junk food with junk mail, junk yard, junk items, and so on and so forth. So please, if you can carry your tiffins from house and try to avoid junk food, that will be great. And many of us have become obese or overweight. Cancer actually is the heavy cost of being heavy. And obesity has been linked to 13 types of cancer. And we see obesity in even childhood. And it is observed that 50% of obese children remain obese even in adult age. तो बच्चों को खिलाने की और दबा के मक्खन खिलाना है और घी खिलाना है और उनको कहना है कि कंप्यूटर के सामने बेटा बैठे रहो और टीवी देखो, ये मत करिए. Let them play, let them enjoy, let them have outdoor games rather than forcing them to sit at home and not do any exercise. I see many of you carrying multiple phones वो जो स्टॉक ब्रोकर के लोग हैं ना, वो 4-4 फोन अपने पॉकेट में रखते हैं. And I'm sure you must have seen, this is also cutting from Times of India, that 4% increase in risk of brain cancer among teens using smartphones excessively. People using more than 10 hours of screen time. Screen time means your mobiles, your computers, your TV screen. If your screen time is more than 10 hours, you are at increased risk of developing cancer. And specifically, there is something like cancer in the ear, acoustic neuroma. Of course, there are other disadvantages of using screens excessively, and mobile phone if you are using while driving, you get distracted. The fertility of these people is poor. There's DNA damage to males, people who carry their mobile phones in pockets. And females can have miscarriages. Morbidity of the unborn child is high. And screen time, if it is high, is related to high BMI and high chances of obesity. And the sleep pattern of these people is irregular. Just few minutes back, you said you are stressed. Now, the common question asked to me is, does stress cause cancer? Stress directly doesn't cause cancer. Stress actually affects your immune system. And immune system is quite important, very important to destroy the early forming cancer cells. As soon as an abnormal cell is produced in the body, a good immune system fights and kills that cancer cell. But if your immune system is disturbed, then your cancer cells will not be killed, and you become more prone to develop cancers. There are some type of viruses, HPV, HSV, EBV, AIDS virus, hepatitis. So many viruses are known to cause cancer. Chronic irritation by bad teeth can cause oral cancers. And bad hygiene of the private parts, penile area, can cause, means poor sexual hygiene can cause कैंसर. एक बार कहीं मैं बोलने गया था, उन्होंने मेरे को कहा, जैन समाज, कि अस्वच्छता और असभ्यता से कैंसर का क्या लिंक है. I thought over the topic so many times, but then I thought that the conclusion was अस्वच्छता और असभ्यता से ही कैंसर होता है. Your hygiene is not good. You're smoking all the time. You're chewing tobacco in public or even at home. Your diet is not proper. So all these are bad habits. Your bad lifestyles, they're all related to cancer. Cancer is not an inherited disease. It is a man-made disease and is largely preventable tragedy. But the question is, how can we prevent it? See, most important, I'll appeal to all people who are smoking and tobacco chewing. Quit smoking or tobacco chewing today. Within 8 hours, the carbon monoxide level in the blood drops to normal. Oxygen becomes normal. Within 2 days, you have a better smell and taste sensation. Within 1 to 3 months, circulation of body improves. Your lung functions improve by 30%. Within 6 months, the coughing, sinus congestion, fatigability, etc., they just disappear. And within 1 year, the risk of heart diseases becomes half that of a heavy smoker. Within 10 years of living, risk of dying from lung cancer is reduced to half. You see, whatever has gone in. But if you stop it, then the chances of dying from cancer become less. So you can prevent cancer. Avoid using indiscriminate estrogen. वो 45 ईयर 50 ईयर की एज पर जब मेनोपॉज आना होता है तो लेडीज ये हार्मोनल टैबलेट लेना शुरू कर देती हैं बिकॉज दे वांट टू स्टे यंग. बट आई कैन टेल यू cancers like breast cancer is estrogen dependent, hormone dependent. Some of the cancers are hormone dependent. So you are inviting trouble for yourself. Hold on to one partner. Avoid preserved food, nitrites, nitrates, ये barbecued food जो हैं ये avoid करने चाहिए. तभी इतना प्रचलन है organic food का. Avoid color additives. So whenever you use fruits and vegetables, wash them well. Off all the insecticides which have been sprayed on the fruits and vegetables. And it is mentioned in literature that if you reduce the risk, the cancer risk can be reduced by 30% if you leave tobacco habits. If you have proper diet, you can reduce the risk by 15% more. And if you reduce your weight, do some exercise, 15% more. So about 2/3 of the cancers can be prevented if you eat right, breathe right, weigh right, and live right. And there is another way of preventing cancer, that is vaccination. It has come up for cervical cancer, and people have started recommending even for male cancers, especially the genital cancer, tonsil cancer, but not widely prescribed amongst males. Now, the other recommendations are eat more fresh vegetables, fruits, have high fiber diet. Indian diet is rich in fibers. No junk food, control your weight, burn your calories, stop smoking, stop chewing tobacco or gutka. And my friend said that allow some alcohol, so I always write, go easy on alcohol. The other aspect, just 5-7 slides more, that you should have a screening. Screening means regular checkups. आपकी कार की सर्विसिंग कराते हो ना, अपनी गाड़ी की सर्विस, गाड़ी सबके पास होगी, 2-2, 3-3 कार्स होंगी सबके पास. सर्विसिंग कराते हो, 10,000 किलोमीटर हो गया, 5,000 किलोमीटर हो गया, या 2 महीने हो गए, 6 महीने हो गए, सर्विसिंग के लिए ले जाते हो. कार कोई तकलीफ थोड़ा ना दे रही है, फिर भी सर्विसिंग कराने जाते हो कि कहीं गाड़ी सड़क पे खड़ी ना हो जाए. अरे भाई, अपनी गाड़ी की सर्विसिंग कराते हो तो अपनी सर्विसिंग कभी कराई है? तो आई सजेस्ट यू ऑन वर्ल्ड कैंसर डे, you should get yourself serviced and have a health checkup by a qualified doctor. Go to a nearby hospital, have all the tests done. That is early discovery and early recovery. Cancer sends you certain warning signals also. Just these are few ones. If there is change in bowel or bladder habits, you should know these. 45 साल की उम्र के बाद आदमी कहता है भाई रात को उठना पड़ रहा है बहुत ज्यादा, या पहले डायरिया हो जाता है, कभी कॉन्स्टिपेशन हो जाती है, पेट खराब रहने लगा है, इंडाइजेशन हो गया है, या जख्म बना है मुंह के अंदर या कहीं स्किन में या ब्रेस्ट में, हील नहीं कर रहा, अनयूजुअल ब्लीडिंग हो रही है कहीं से, टट्टी के रास्ते, नाक के रास्ते, पेशाब के रास्ते, फाउल स्मेलिंग डिस्चार्ज आ रहा है कहीं से, लंप ब्रेस्ट में है लेकिन पेन नहीं हो रही. I can tell you more than 95% of the breast lumps are painless to begin with. So don't ignore the painless lumps. Indigestion or difficulty in swallowing. खाना खाते टाइम कुछ पानी पीना पड़ रहा है तब नीचे उतर रहा है, नहीं तो नीचे नहीं उतर रहा. Immediately consult somebody. Change in wart or mole. तिल सबके होते हैं. till में कोई change हो रहा है, if you have nagging cough or hoarseness of voice lasting for more than 3 weeks, low-grade fever, loss of weight, loss of appetite for more than 3 weeks, immediately consult a doctor and insist on investigations. There's no single blood test or urine test that will diagnose asymptomatic cancer. So, female cancer, I'm just repeating, are curable. They can be detected early by some investigations like a pap smear. बच्चेदानी के निचले हिस्से से पानी लिया जाता है, उसको टेस्ट कर लेते हैं, which is called pap smear. And breast self-examination as well as a mammogram. Mammogram is an X-ray of the breast. You can detect cancers very early. It can be done once in a month after the age of 40, 45 years. Once in a year, mammogram. And breast self-examination, every lady should examine her own breast in front of a mirror and say 4 or 5 days after the periods are over. Male cancers are primarily preventable. Primarily preventable means if you change your lifestyles, don't smoke, keep your weight right, burn your calories, have your diet, timely diet and good diet rich in fruits and vegetables, I think 2/3 of the job is done. There are few investigations which can be done. I don't recommend that you have only investigations for cancer, but you should have checkups for cardiac problem, thyroid problem, diabetes. All health checkups should be done after the age of 40, 45 years. Everybody should have the checkup once in a year. Your body is more important than your cars. That's the last slide. What's your role? Change your lifestyles. No tobacco, no gutka, no alcohol. And don't be a night owl. Eat right, weigh right, breathe right, and live right. One partner, small family norm. And service yourself. And if you are a lady between maybe less than 45 years of age and you must be having kids, girl, after the age of 12, you can have vaccination for cervical cancer. And don't ignore any of these symptoms which I have enumerated. They could be the warning signals. If you detect cancer early, treat it early, the outcome is better and you can virtually lead a normal life. I always give an example. Diabetes, hypertension, cardiac problem, thyroid problem, you have to take medicines for life. But if you detect cancer early, treat early, you are virtually cured. You don't need medicines for life. It is a short-term treatment and life can run. Thank you.
Thank you, sir. This was really enlightening. You were right when I requested you to speak on this topic, and you said, everybody, and this is what I got to know, that when you speak, everybody would be glued onto their devices. And I noted many things, and certainly we'll also be, this session is being recorded. I'll rehear it with my wife. We'll try to inculcate what you advised us, Dr. Diwan. Thank you. I hope, please be here because we have certain questions coming up for you. These questions will be taken up once other doctors.
Yes.
Thank you. Thank you, Dr.
Hear the other speakers.
Thank you, Dr. Diwan. Thank you. So nice of you. Now we have Dr. S.M. Shoaib Zaidi. Dr. Zaidi is a renowned surgical oncologist with almost 20 years of experience. He is skilled in performing oncology surgery and robotic surgery. He carries out surgeries for lung cancer, breast cancer, and many other cancers. Dr. Zaidi is popularly known as a specialist who has performed the first robotic surgery for lung cancer in Delhi in 2011. Dr. Zaidi has history of providing 100% relief to cancer patients. He is pioneer in introducing an innovative technique for head and neck surgery as radical neck dissection, which helps to preserve the marginal nerve in order to ease the procedure. Thank you, Dr. Zaidi, for for agreeing to come on our request. Satvinder sir, I can see him here. Mr. Satvinder Singh requested Dr. Diwan and Dr. Zaidi both for this program. Dr. Diwan, your address was very, very lucid, very simple, very with no technical terms. Anybody and everybody could have understood, and I'm sure all doctors will be able to simplify the guidance for us. Dr. Zaidi, over to you.
Thank you, Chawla ji. Thank you, Satvinder ji, for giving this opportunity. So, my topic is understanding cancer treatment. So, I have tried to simplify it as much as possible. But if you have any queries, you can always ask me after the presentation.
By the time Dr. Zaidi is, I think, putting on the
sharing is coming as disabled. I don't know. I have shared my presentation with Alka ji.
So Alka ma'am would be able to screen share the same. That's how I realized. Even Dr. Diwan's presentation, we'll request Dr. Diwan to send it to us. We can certainly take use of the same. Unfortunately, we couldn't see it because of the screen sharing difficulty. Dr. Zaidi's presentation is here. Maybe at the end, Dr. Diwan, I am sending you my email ID. If somebody can email us the presentation before we end the presentation for 5 minutes, we can just again screen share if required. People can note certain things from the presentation as well. Over to you, Dr. Zaidi.
Yeah, please let me know when my time is over. I will stop the presentation. So next slide, please. Now, just a brief, idea about diagnostic procedures, starting with the blood test, which includes some cancer markers, and biopsy is the most important, investigation which is helpful in diagnosing the cancer, and the only investigation which diagnoses it 100%. And the biopsy is available in several forms. Now we have liquid biopsies, especially for patients who have got widespread disease in the rest of the body. Endoscopy is used to diagnose intestinal or stomach cancers. Then we have basic ultrasound, which is the initial investigation of choice for different, abdominal problems or neck problems as well. A CT scan is more sophisticated investigations. CT scan, MRI, they exactly locate the cancer and the sites of spread. The PET scan basically is a whole body imaging study. It can be either a PET CT or a PET MRI. The PET CT or a PET MRI, it can detect the spread of cancer, but it is very important for us to know that PET CT or PET MRI are not diagnostic. We cannot make a diagnosis of cancer just by doing a PET CT or MRI. The diagnosis is established by a biopsy procedure or a cytology procedure. Cytology is just aspirating few cells from the tumor and that is seen under the microscope. More sophisticated investigations like we do endoscopy, and at the tip of the endoscope an ultrasound is fitted, and that is used to know the depth of involvement of tumors in the intestines or food pipe or stomach. And there are more other investigations like laparoscopy, which is putting a camera inside the abdomen, and the same when it is done in the chest, thorax, it is called thoracoscopy. Next, please. Now, there are several types of cancer treatments available. The most important ones are surgery, which is the oldest form of cancer treatment, followed by radiotherapy. Radiotherapy is the treatment of cancer by X-rays or gamma rays or different type of beams. Surgery and radiotherapy are local treatments of cancer. They treat only that particular site or the region where the cancer is present. Chemotherapy, on the other hand, is a systemic treatment. It goes into the blood and takes care of cancer cells circulating in the blood, and it also goes to the local area and reduces the size of the tumor if it is being given before the operation. Immunotherapy is a new form of treatment where the body's own immunity is utilized to fight against cancer. Targeted therapy is similar to chemotherapy, but without adverse side effects, with very minimal side effects. I will come and touch upon all these modalities of treatment in my presentation. Next, please. Now, the goals of cancer treatment. to cure the cancer if the cancer is localized to a particular organ, or if it has got limited sites of spread. Unfortunately, in India, majority of patients which we see, almost 2/3 are beyond the scope of surgery or the local treatment, and they have metastatic disease. Only 1/3 of patients are potentially curable. The other goal of treatment is to manage the complications of cancer itself and the complications of the treatment. Palliative treatment is a treatment which is used to relieve symptoms, either arising because of the cancer or because of treatment. Palliative treatment can start simultaneously with a curative treatment when the cancer is being cured to relieve the patient's symptom. And the psychosocial support is very important because depression is very common in cancer patients, and it is one aspect which is frequently ignored by patients as well as doctors. Next slide, please. Now, the treatment options depend upon the type of cancer and the stage of cancer. The investigations which I enumerated, help us make a diagnosis and to know what is the exact stage of disease. It also depends upon the type of cancer, type of treatment, depends upon the age of the patient and overall physical condition of the patient. And personal choices are always, involved. Some patients do not want to undergo surgery, and some patients do not want to take chemotherapy. Next slide, please. Now, whenever we have a cancer patients after complete diagnosis, a team of specialists sit and discuss about the different treatment options. And it's a big team, including surgical oncologists, radiation oncologists, medical oncologists, which give chemotherapy, physicians, pathologists, radiologists, molecular oncologists, nutritionists, physiotherapists, nurses. It's a never-ending list. So all the important team members, they sit together and they plan the treatment. For early cancer, sometimes surgery is the only treatment which patient needs. And at other times, with the limited spread, we combine other treatments like addition of chemotherapy or radiation or hormonal. Next, please. Coming to surgery. Surgery is the oldest form of treatment. It is difficult to know when the first cancer surgery was carried out, but the modern cancer surgery, dates back to the 18th and 19th century, where the first cancer operations were performed. Mastectomy, removal of the breast, was performed in 1804. And similarly, most of the surgical procedures which are described for treatment of cancer were, initially done in 18th and 19th century. So the surgery is a local treatment. We remove the local disease or the regional disease in the form of lymph nodes, because most lymph nodes are small glands in almost throughout the body, which usually are the first site of spread of cancer. The surgery removes the primary tumor and the lymph nodes, and surgery itself can be curative for many cancers if the cancer is caught and treated early. Next, please. Now, these are the different surgeons. The surgery date back to 129 AD. Galen, Hippocrates, Ashley Cooper, John Hunter, who is considered father of this modern scientific surgery. Before the advent of anesthesia, the surgery used to be performed under, without any anesthesia. It used to be very painful, but hats off to those surgeons who have described the procedures which we do now without any modern equipment or facilities. Next, please. Now, the indications of surgery are, I'm talking about, most of my slides are for solid tumors. The surgery is done usually for solid tumors. For both blood cancer or liquid tumors, usually the chemotherapy is the treatment of choice. Now, the surgery is done for cancer which is localized or cancer which has got loco-regional disease. Nowadays, with modern medicine, we are able to do surgery for patients who have got stage 4 disease with some survival advantage. For example, in cancer of the intestine, large intestine, or which is also called colon or rectum. The surgery can be done when there is a limited spread to the liver or the lung. So the cure rates can be as high as 25 to 30%. Next, please. Initially, for cancer surgeries, radical surgeries used to be performed, where, for example, for breast cancer, the entire breast used to be removed. For a cancer of the leg or arm, the amputation used to be done. And nowadays, the focus is more on the organ conservation. For early tumors of the breast, we don't remove the entire breast. We just remove the tumor along with the margin of healthy tissue, which is also called partial removal of breast conservation. For arm and leg tumors, if major nerves and arteries are not involved, we do limb salvage procedures. For cancer of the voice box and the head and neck involving jaws, the jaw can be saved by using modern surgical techniques. The larynx also can be saved partially, or if the larynx is removed completely, there are devices like electrolarynx which can help patients speak. The sphincter, which is a muscle which controls the passage of stools, we can preserve it for rectal cancers, and patients can avoid a permanent bag for the passage of stools. For cancers of the kidney, liver and lung, we can do partial removal of these organs to conserve the function of these organs. For cancers of the brain, which is outside our domain, it's treated by neurosurgeons. Awake brain surgery, awake craniotomy is done to minimize the extent of resection and to conserve the form and function. And just a gory picture of the thigh cancer involving the bone, which has been removed. Patient was given chemotherapy. This patient was studying in class 10th when she came to me in 2012, and she had a fracture of the thigh bone, and she was investigated, and then we started her on chemotherapy. The tumor reduced in size, so then she was made suitable for limb conservation procedure, limb salvage. And then we removed the lower thigh bone. And next, please. This is the lower half, almost half of the thigh bone was removed. Next. And modular prosthesis was fitted, which was connected to the remaining thigh bone, and the part of it was forming the knee joint of the patient. So this patient, is still alive. She's, she came to me 4-5 years ago. She wanted to do medicine, but she could not be selected here. Then her father came and asked me whether I should send her. She wants to go to Russia to study medicine. I said, yes, you must send her. So she has completed her medicine. She's almost completed her medicine. She's in final year, and she will be a doctor next year. Next, please. So she's Bhavna. She will be coming back next year from Russia for her practice. This is another patient, cancer of the leg. Next, please. This is a patient with localized cancer of the breast, not very small, but not very big either. She had partial removal of the breast, and she underwent a flap procedure. You can see a flap here for cosmetic purpose. So that's how we could save the breast. She went on to have chemotherapy and radiation. Next, please. This is a patient who had a big tumor to begin with, and we had to give her chemotherapy, and the tumor reduced in size, but she was not suitable for partial removal, so we had to remove the full breast. Next, please. And after removal of the full breast, the plastic surgeons did plastic surgery and reconstructed the breast. Next, please. This is how a reconstructed breast looks like. And then patient completed her treatment. Next slide, please. Oral cancer, relatively early. Patient went on to have surgery. Next, please. This was removed. This is the cancer which was present, and it was removed with margin, with limited resection of the jawbone with teeth, 3 teeth. Next, please. and you can see the patient recovered well after the defect was reconstructed. Next slide, please. Big tumor of the jawbone. Dr. Diwan is head and neck specialist. I'm sure he will have lot of material to share with you, maybe next time. But these are my humble. This is my humble experience, which I'm sharing with you. Next slide. Jaw bone cancer. The front part of the jaw was resected completely, and then the defect of the jaw, the thin jaw was replaced by a bone from the leg, which is called microvascular flap. Next, please. And this is how she looks after the surgery. So she will not have teeth here because she had advanced cancer. She had to undergo radiotherapy procedure as an adjunct after treatment, after surgical treatment. This is the cancer of the larynx patient. After the voice box was removed completely, he's using electrolarynx for speech. This is a small device, not very expensive. The patients can speak. The voice looks little, computer-like, but it's very helpful for patients because they are able to communicate with the family members, and they are able to live a good social life. Next slide. This is, just to show you, cancer which has spread all over the place in the abdomen, cancer of the ovaries. And you can see small deposits here marked with a blue arrow. So it is a latest treatment which is called hyperthermic intraperitoneal chemotherapy. Just in short, basically the chemotherapy drugs are administered. They are instilled inside the abdomen at a higher temperature, around 42-43 degree temperature. And after removing the cancer completely, these drugs are instilled, and these drugs are circulated in the body with the help of a machine and at a higher temperature for 60 to 90 minutes. And after the procedure is done, the abdomen is closed. This has been shown to improve outcomes and survival in patients of ovarian cancer and patients of large intestine cancers. Next slide, please. You can see the cancer has been removed. The inner layer, the inner skin, which is called peritoneum, has been removed with a lot of small deposits all over the place, and the organ was removed, and subsequently the abdomen was closed with, you can see the big drains coming out. These drains are for the inlet, and this is for the outlet of chemotherapy drugs which are instilled. Next, please. You can see this is the machine which is used to circulate chemotherapy drugs. It has a thermostat which can maintain the temperature to 42-43 degrees Celsius, the inner temperature and the outside temperature. And this procedure can be done in thorax also. Thorax means chest, cancer of the chest. Sometimes there are cancers like mesothelioma or some disseminated, some sarcomas which have spread to the lungs or outer surface of the lung. So this procedure can be used for the chest cancers as well. So this is the chest which has been closed after removing the cancer, and you can see the procedure being done. It is called HITHOC for the chest. This is the latest treatment which can help increase the survival of the patient after the standard surgery and chemotherapy. Another form of treatment for advanced cancers, which is a pressurized chemotherapy, pressurized intraperitoneal chemotherapy, in which no surgery is performed, just a small incision is given, and the chemotherapy drugs are aerosolized. They are circulated. They are basically, aerosol is a air containing some particle, whether it's a drug or any other particle. It's called aerosol. So the circulation of this during chemotherapy or after treatment with chemotherapy helps in improving the outcomes. Next, please. This is just to show you that the aerosol is, there is a machine which generates the aerosol of the chemotherapy drugs, and the entire abdomen. You can see the liver, kidneys. This is just to show the principle. Next, please. Now, most of the surgeries involving cancers, especially the advanced cancers, are open surgeries. But for early cancers, Smaller incisions are given, minimally invasive surgeries are done, and the robotic surgery. The minimally invasive surgery, basically we make small 1 centimeter or half centimeter incisions through which the camera and instruments are introduced. This is the a form of minimally invasive surgery which is called robotic surgery. This is the surgeon who is sitting here on the robotic console. This robotic console has magnified vision and more than 10 times magnified, and you can see the surgeon sees to the vision is actually three-dimensional. So the patient is able to have good view of the operative field. Patient, the surgeon does not surgeon is not in physical contact with the patient. You can see the robot is introduced inside, and the robotic camera, robotic instruments. There is a surgeon who stands near the patient, who is responsible for taking out instruments, introducing instruments inside, and just in case if there is a complication like bleeding, so the surgeon who is standing here takes control of the situation until the other surgeon scrubs up and watches. Now you see these are the pair of master controllers which the surgeon who sits on the console manipulates, and the movement of these master controllers translates into movement of the robotic arms inside the patient's body, and that actually the surgery is performed by the surgeon, but this sophisticated robot helps in doing this procedure in the minimally invasive way. Next, please. Now you can see the robotic arms are draped in a sterile, clean drapes, and the surgeon who's there at the patient side, usually you can see him relaxing here, and the actual surgery when it is being performed by the surgeon. So the surgeon who is performing the surgery has full control of all these robotic arms. Some of these arms are holding the tissue, some of these arms are doing the actual surgical procedure, and there is a camera arm. Next slide. You can see a human, the normal instruments have limited movement. On the other hand, these robotic arms have 7 degrees of motion. It can be like a human wrist, where it can move back and forth. It can rotate along the axis 360 degree. So there are joints here, there are joints here, and there are joints here. So the maneuverability of these robotic arms is great inside the patient's body. That is very helpful for the surgeon. Next slide, please. Next, please. We can skip this. Next, please. Next slide. You can see after the minimally, this patient underwent robotic left nephrectomy. Nephrectomy is a removal of the kidney. It was a partial nephrectomy, partial removal of kidney, and this gentleman underwent removal of the lobe of lung with the help of robotic surgery. Traditional incisions are big incisions going all the way up to the back from the front, at least 30-35 centimeters, but this form of surgery causes less pain, earlier discharge from the hospital, earlier return to their normal activities. Next, please. Now coming to another form of treatment, radiation therapy. Radiation therapy is use of various forms of rays like X-rays or gamma rays or beams to kill cancer cells. Radiation is used for wide range of cancers, either alone or in combination with surgery and chemotherapy. And almost about 2/3 of cancer patients, they will receive radiation at some point as part of their treatment. And it is also, like surgery, is a local treatment or loco-regional treatment. It can be curative alone in early cancers. Next. So the radiation machines have been in use for last so many years, and the technology is fast changing. Now we are getting a lot of modern radiation machines with ability to deliver the right dose or the higher dose with minimal side effect. Next slide, please. So radiation works by killing or damaging the DNA within the cell and destroying their ability to reproduce, and ultimately these cells die. When they cannot reproduce, they die. And the damaged cells are eliminated by the body. The normal cells can also be affected by radiation, but usually they can repair themselves because their DNA is normal. And we have mechanism in the DNA where the DNA damage because of radiation can be repaired. Next slide, please. Radiation is quite safe cancer treatment modality. A team of doctors, including radiation oncologists, medical physicists, a team is involved. They are responsible for planning the field of radiation with the minimal side effects. Next slide. So the radiation is used as a curative modality, the curative treatment. It can cure cancers in different parts of the body. And after the surgery is done to completely remove the cancer, radiation is used to treat the tumor bed to reduce the chance of recurrence. And sometimes the radiation is used before surgery to shrink it before a better surgery can be performed to remove the entire disease. Radiation is also used for palliation. Palliation means to reduce patient symptoms in patients who have advanced cancers and where the disease cannot be controlled. It can relieve cancer pain and it can relieve nerve pain by reducing the size of the tumor. Next slide. This is how radiation is delivered. It can either be an external beam. This you are seeing the external radiation where the machine rotates around the patient to deliver the right dose at the right site. And it can also be internal radiation therapy, where the radiation is given either with the help of some needles or implants, which can be put inside the patient's body. Next slide, please. This cancer, I showed the picture of a leg initially. It had to be here. So the cancer was removed, and the patient. Next slide, please. It was a sarcoma. Now the patient is being treated with the internal radiation where the needles are introduced and the iridium will go inside these needles with the help of a machine. And during the surgery itself, this radiation treatment is given. And you can see a flap of tissue here, which will be used to cover this defect after the radiation treatment is over. Next slide, please. This you can see the location of the tumor. This has been closed with the flap, and these are the needles coming out. After surgery, after the wound partially heals, the needles will be introduced inside, and the treatment will be given. And subsequently, these needles will be removed from here. And the area donor site has been skin grafted. Next slide, please. This is the final outcome. Next, please. Now there are temporary implants or permanent implants for the internal radiation. We can skip the details. Next, please. Now the side effects are usually tolerable. Most side effects are usually in the second or third week of treatment. Some medications are given by the doctors to relieve the side effects. Side effects like skin redness, skin pigmentation, they are limited to the area where the radiation is being given. Fatigue, weakness is a common side effects of radiation. Sometimes the skin may peel off. That happens in minority of patients. Side effects may last for a few weeks, and usually by the end of 8 weeks, the side effects are usually relieved. There are some permanent things which can happen after radiation, like swelling of the tissues and hardening of the tissues. Next, please. Next slide, please. Now, this is another form of radiation which uses proton particles, proton beam radiation. It is a very expensive machine. This was installed in Apollo Chennai, and it is better than standard conventional radiation of X-ray or gamma rays. Next, please. In certain ways. So these are the indications of proton therapy. These are not absolute indications, but yes, whenever proton beam is given, the absolute indications are, if I have exceeded the time, I can stop it here. Please let me know.
You may conclude in 2 minutes if you can, so that we
okay.
2-3
So
minutes.
there are various advantages of next, please. Next slide, please. So the benefits are, less radiation to the healthy tissue, and more dose can be given to the tumor area. These are the main advantages of proton. Next, please. There are disadvantages like limited availability. There's only one machine right now available in India, but I'm sure more and more cancer centers will be installing these machines. The cost is huge, and not all cancers need to be treated with proton therapy. Usually, it is good for central nervous system cancers, pediatric cancers, and cancers where higher dose of radiation is required with less side effects. Next, please. Now coming to chemotherapy. Chemotherapy is a treatment which is not a local treatment. It is given inside the blood. It is a drug treatment, which is the drugs are injected into the patient's body through the blood, and these drugs are chemicals which kill the fast growing cells in the body. These are called chemotherapy drugs, and these are drugs that are used for treat different variety of cancers, and usually the cancer cells are killed earlier because the normal cells do not get killed. They recover after the chemotherapy. Fast growing cells, which are cancer cells, they are fastly multiplying and they are killed. Not all cells get killed. Cells which are chemotherapy resistant, they remain inside the body and they can be removed by surgery if the cancer is limited to the local regional area. There are many chemotherapy drugs available. They can be given alone or in combination to treat cancers, and there are different standard regimes available for treatment of different cancers. Next slide, please. Chemotherapy drugs act by DNA damage, RNA damage. They inhibit the multiplication of cells. Sometimes for blood cancer, they can be the only method of cure, and sometimes they are used with surgery or radiation therapy. And it is a systemic treatment. It is also used in patients who cannot be cured, just to reduce patients' tumor size and to palliate symptoms. Please.
We have some questions which
Yes.
We are noting. If we'll ask you to stay back, and would request if those, I'll address these questions. I'll put up these questions to you once all the speakers are finishing.
I think the most important part is over.
Okay, great.
I can conclude.
Yeah, sure, please.
So mainly these three forms of treatment. The immunotherapy is a new treatment which uses patient's own immunity, modulates the patient's body immunity to kill cancer cells. Immunotherapy is right now being given, but it is very expensive. I'm sure the drug costs will come down in next few years. Hormonal treatment is given for breast cancer and ovarian and endometrial cancer. It is a very important form of treatment which kills cells slowly with very, very, very minimal side effects. The side effects of chemotherapy also are tolerable in most patients. Life-threatening side effects are very few. So the patients and the family, they should not worry about chemotherapy. It does not kill patients. Now it is modern chemotherapy, modern surgery, and modern radiation. The treatment-related deaths and the morbidity is very few. Thank you so much.
Perfect, sir. We have some questions which we'll request you to answer a bit later. Now, in fact, obviously, Dr. Diwan has, with his own experience and command, shared the preventive steps which one must take, change in lifestyle, and also early detection. Dr. Zaidi has certainly shown us the way treatments are done, although the pictures were a bit concerning, but I'm sure these people who got the surgery done are happily living, including that female girl who is now becoming a doctor. So congratulations to you, Dr. Zaidi, for the great work you're doing. Now we have our third speaker for the day, Dr. Gauri Rockam. She is a PhD in Yoga and Life Sciences. Now, after showing you the treatment, certainly we must resort to Dr. Gauri, because unless we imbibe what Dr. Diwan said, eat more vegetables, eat more fruits. It is difficult for us to come out of it, and you can see the picture here, which gives us an indication, because Dr. Gauri is also an MSc in food and nutrition, and she's a topper from Bangalore University, and she's also a certified sports nutritionist, and so on and so forth. She is also a certified diabetics educator, yoga instructor, therapist. So without much ado, I would request Dr. Gauri to please guide us as to how we can prevent and reverse cancer with holistic approach and your holistic nutrition. Over to you, Dr. Gauri.
Thank you so much. My respectful pranams to each one of you who have joined us this afternoon. As Chawla ji rightly said, what we saw just now gives us enough motivation to what I am going to say after this. And I call myself a holistic nutritionist because I blend the Eastern and Western food principles. And I have chosen Nature Cure and yogic philosophy of food because these are the two philosophies which speak about and deal with enhancing health rather than dealing with the diseases. And that's my whole interest here. Now, thanks and respects to both the eminent doctors who shared their valuable knowledge with us all about cancer. And this is just to repeat what Dr. Dhawan said. And cancer is just unnecessary abnormal growth and multiplication of the cell, which interrupt and disrupt the normal functions of the cell and can spread to different body areas also. And emerging evidence clearly shows that almost 90% of the cancers, various cancers, are a combination of wrong diet, wrong lifestyle, and wrong environment, very little to do with genes. And today we clearly understand with epigenetics that, the wrong genes express themselves only when all the conditions and the environment inside the body allows it to express. So, which means to say, if a person has every member of the family having cancer, yet he need not have, if he can create the conditions inside the body with right diet, right lifestyle, and right environment in the right way, there is no need for him to go through this suffering. So which needs to say that starting now, we can actually reduce and remove the risk of cancer by simply eating right and living right. Now, what in the diet promotes cancer is the next important thing to understand. There are two classes of foods. That is, one is the refined and processed foods which are made in the factory, and the other class is the animal foods. Let me touch upon them, why they promote cancer. Both these foods do not have any fiber. Fiber is very essential in our foods so that it slows down the digestion and assimilation, where it reduces the blood sugar levels. If blood sugar levels increase, it increases the insulin levels, and insulin is a growth hormone. Huge amounts of insulin for a longer period of time promotes cancer. These two classes of foods are rich in toxins and chemicals, say just to name a few of them, coloring agents, preservatives, flavoring agents, taste makers, all of these which are cancer promoting. And these two classes of foods have very, very little or almost no vitamins, minerals, antioxidants, and phytochemicals, which are absolutely necessary to protect us from cancers. And coming to the animal foods, last 2 or 3 decades of research is showing very clear data that animal protein increases or promotes cancers. Why? They raise the insulin-like growth factor 1. It is also an hormone, and this hormone actually promotes growth, multiplication, and spread of cancer cells. Some of the observational studies clearly show that IGF-1 promotes cancer and tumor growth in breast, in prostate, and colon. They also, kind of compromise the natural killer cells in the body, and also they promote mutations and thus are responsible for cancers. So it's very important to take care of these two classes of foods. One of the pioneers, Dr. Colin Campbell, who used to be the professor emeritus at Cornell University in the Department of Nutritional Biochemistry, was the one very early on who proved that animal protein causes all of this and leads to cancer. And another important work he did was that he also proved that plant proteins do not behave like this. And that was his important, proofs. And many people have worked in this sphere in the last 20 years and speak the same language. So what is the solution? Solution is whole plant-based foods. And the word whole is what is most important here, because most Indians are plant-based, but the problem is they eat the processed and refined foods. So that whole word is what is the key here. It has to be plant-based and it has to be wholesome. Why? Because the whole plant-based foods are rich in fiber, vitamins, minerals, antioxidants, and phytochemicals. What do these components of whole plant-based foods do is the next question. They have anti-tumor or anti-cancer activities. What are they? The very first thing is the fiber do not spike up insulin and the insulin-like growth factor, which are the basic causes for the cancer to happen. Then they inhibit the multiplication of the cancer cells. They inhibit the new formed blood vessels which supply oxygen, nutrients and blood to these tissues and cells. They promote the natural death of the cancer cells, and they can have highly anti-inflammatory and antioxidant qualities because of the presence of all these vitamins, minerals, antioxidants and phytochemicals. So understanding this, that the whole plant-based food is the solution, how do we actually adopt it into our lives? Every time you pick up a plate to eat, divide the plate in this fashion. And the first part, you should get something from whole grains. What do I mean when I say whole grains? Whatever grain you're eating, you don't have to change them. Just make it wholesome. Giving you an example, if you're eating polished white rice, it needs to become unpolished rice. Whatever unpolished rice variety you get locally in your area, just ensure that they become unpolished. It need not be brown, black, red or whatever other color. It need not be, because sometimes the red color puts off people and they don't like eating rice in that way, because we are obsessed and we like everything white, right? So it not necessarily be red and brown, but it should be just unpolished. What is this unpolished rice? It has the outer husk. When there is an outer husk, it also has the micronutrients. That's the whole crux of the matter, to have the outermost covering of everything, which is the fiber. Now make all your grains whole grains. What do they give? They give us healthy carbohydrates. People are scared of carbohydrates. We need not be bothered about carbohydrates when we are eating our foods wholesome, right? So other grains, for that matter, the flours, buy the grains, buy organic grains, get it milled. You have to go back to your roots. You cannot say, I don't have time. You cannot give the excuses of, I can't make efforts. Whatever your parents and grandparents did was the right way of eating, and we have to get back, right? So go to a mill, get it flour, and you have to use those atta. When it comes to poha, it has to be the thickest poha. When it comes to rava, it has to be big rava, so that all these grains have fiber and the micronutrients. Coming to the next part, get something either from the grams or dals or nuts. Remember, it is or. Don't put all of them together and eat huge amounts of these, because we have a craziness of increasing proteins. And especially in cancer, it is very, very important to reduce this part of dals, grams and nuts. And when it comes to the dals, make them wholesome. How do you make them wholesome? Keep the dals with husk, chilke ke saath. Coming to the next, and what do they give? They give just enough proteins. Coming to the fats, the lesser the better. Even that minimum amount of fats you use in your cooking, ensure they come from the unrefined cold pressed oils. Whatever oil you want to use and has been used in your family for generations together, use that fat, but keep it unrefined. That is double refined, triple refined oils, or no, not the right kind of oils. Use the unrefined oils as less as possible. Does that mean that body does not need fat? Absolutely no. Body needs fat, but not in the form of bottled oils and fats. It needs in its natural form. What are the natural forms of oils and fats? Say, just to give you some examples, coconut, copra, til, mustard, avocados, what else? Nuts like groundnuts. All of these give us natural fats, and this is what should go into our recipes. Now coming to the next part, include huge amounts and varieties of vegetables and green leafy vegetables. And the important part here is to keep the skin on. Do not remove or peel off the skin. Keep the skin. And coming to the last part, include lots of raw vegetables also, and remember to keep their skin. And includes lots of fruits also daily. And wherever possible, keep the skin on, like say chickus or apples or guavas and pears and things like that. And do not consume fruits with the meal. Always consume fruits between meals. What do these class of foods give us? Vegetables, raw vegetables, cooked vegetables and fruits. They supply vitamins and minerals. Now that you have all the nutrients coming from this plate, this is a wholesome, healthy, balanced meal plate. And if you keep them whole, they also supply more fiber, more micronutrients and antioxidants and phytochemicals, which will do all the job which we discussed earlier and what Dr. Dhawan also discussed. Now, this is just looks like theory. What does it translate it to in our plates? This is how it looks on our plates. The unrefined whole plant ingredients are used to make all these your normal foods only. They are not some special specific foods. The special specific or superfoods do not work. If they did, we wouldn't have cancer in this world, right? It is every food you eat which you should make it fiberful and nutrient rich food. Well, every expert, every clinician, every researcher and oncologist who spoke in Food Revolution Summit spoke the same language. And I'm quoting from there one Dr. William Lee, who said, we hold our destiny 3 times a day in choices that we are making when we sit down eating our breakfast, lunch and dinner. It is very, very true. And it doesn't end with diet. Diet is just half of the story. But the other half of the story is healthy lifestyle. It is equally important to ensure that we get a right lifestyle. The research from National Cancer Institute says only everyday good physical activity will decrease the growth factors and the growth hormones released highly inside our body. It reduces insulin, it reduces inflammation and also reduces obesity, which is the cause for many varieties of cancer. It is very important to have any physical activity which you enjoy, but 1 hour in a day is very, very important. Whether it is walking or jogging or swimming or dancing or playing a game, what gives you joy? Coming to the sleep, Sleep Foundation research says lack of sleep and rest is responsible for disruption of circadian rhythm, the natural rhythm in the body, which signals mutation and DNA damage. So don't take it lightly, as the doctors were saying very rightly. It is very important not just to get enough sleep, to get at the right time. The early hours of nightfall is when the hormones of repair and rejuvenation are produced. So it is very important to sleep early and sleep well, sound sleep for a longer period of time where your body wakes up on its own completely rested and fresh. If you don't get this kind of sleep, early and sound sleep, where you don't wake up rested, you are bound to end up in this space. Coming to stress, as the doctor rightly said, stress is not directly related, or we don't have any evidence where stress is directly related to the cancer, but the psychological stress can change our behaviors of eating more, excessive eating, or eating the wrong things, unhealthy foods, because unhealthy foods are the one which gives us comfort. Where nothing in my life is working, something goes wrong drastically in my life, finally the foods is the one which I have right on, and I start consuming the wrong kinds of foods. So these stresses in life, somewhere else in the life, is the one which pushes us to eat junk. So we need to take care of that. And also these behaviors are the one which pushes us into tobacco or smoking or alcohol and all the wrong habits which we see in people. And coming to the third factor, which is environment. Of course, this is just a small list which are related to food and health, but we have umpteen number of things which we should look into. Whatever is in our control, whatever we can make, try and see what can be changed so that there are no carcinogens coming into our body. And food on the plate is not enough. We need to see every input going into our body and mind. One of the best ways is to inculcate all the 5 natural elements called Panchabhutas into our system. One thing which I want to specify here for the want of time is the space element, where fasting comes into picture. Dr. Osumi, a cell biologist from Japan, got a Nobel Prize in 2016 for deciphering the mechanisms behind fasting. He has proved beyond doubt that fasting triggers off something called autophagy. What is autophagy? As the name suggests, the wrong cells, the rogue cells, the cells which have wrong information in them will kill themselves on their own, dissolve themselves inside the body when we do fasting. Our people did not do this just like that. No, we can relate it very clearly that Indians have been doing fasting for thousands of years. Take any religion, they might do it in different patterns, but we have been doing fasting absolutely for longer times. So it is very important to bring in this aspect into our daily life, and mind is very, very powerful. It is more powerful than the diet and lifestyle, I would say. So mind actually acts on all of this. So thoughts are very, very important. Whether you think positively or negatively is going to decide where there is a progression or a remission of cancer. So how we think, what inputs we give through senses, all matters. It's not just about prevention, it's also in the cancer patients. So a lot of research reports that there is improved quality of life, intentional weight loss, no recurrence, and improvement in other aspects of health when they get into this whole plant-based diet years after cancer diagnosis, which provoke their dietary change. And if you want to see more case studies or understand more, you can go to these links. And I would take this opportunity to thank Mrs. Sharada, who connected me to this organization, who is a well-known CS here in Bangalore. More than the company secretary, I would say she's a wonderful human being. And she was my client. She did everything I prescribed to the dot, and I'm sure she can vouch for every word I have put here in this slide. And allow me to end by thanking the Institute, the organizers, Mr. President Devendra ji, the Vice President Mr. Manish Gupta ji, and specifically Chawla ji for giving me this opportunity. Wishing you all abundant health. Thank you all.
Thank you, Dr. Gauri. It was really, really helpful. I'm sure I need copy of this PPT, and you can give us the PDF. Already sent. Yes. So thank you. we will certainly look at it again. I'll show it to my kids. I need to explain them because they are the one who, because of whom actually we also eat junk food at times. Because they'll say, no, no, today is Friday. No, no, it's a Friday weekend. We'll order something. And that's how, it goes. It. We are running short of time. We have a specialist, Doctor. Thank you, Dr. Gauri. Please be here. We have a couple of questions for you also. I'm getting a lot of questions on the chat box here. Dr. Priya Tiwari and Dr. Tiwari, especially, in fact, earlier we were able to connect with her, but unfortunately she was not available. But then we again requested, and Dr. Tiwari is an MBBS DNB, currently working as a senior consultant, Department of Medical Oncology at Artemis Hospital, Gurgaon. Dr. Tiwari did MBBS from AIMS Institute, Delhi, and she has many experiences and many specialities. Would request Dr. Priya Tiwari for sharing with us some out of box things, some practical exposure experience, very briefly, so that we can take some questions also. Dr. Diwan is also waiting. Would request Dr. Priya Tiwari to please come over. Am I audible?
Yes.
Okay. Alka ji, Dr. Tiwari, I think, is not able to unmute herself because I couldn't see her. Okay, by the time Dr. Tiwari is joining, let me ask one question to Dr. Diwan. Dr. Diwan,
Yes.
if you allow me to ask one question.
Yes, sure, welcome.
This question was in my mind. We have received this from our members also. And you won't believe I have been telling my wife from the time we lost, I lost my father-in-law because he was suffering from lung cancer, and we lost him 6 years back. But at that time, he got to know that cancer is caused because of usage of microwave also, microwave oven. Somehow it was his death anniversary few days back, and I again remembered, I asked my wife, yaar isko utha ke fenko yaar, ye, let's keep this microwave out of the home. I have not done my research. People are asking whether it is correct that can consuming food which is heated in microwave causes cancer.
Dr. Gauri is the right person. She is just out of microwave. Gauri, would you like to comment on this?
Yes, doctor. Thank you. Absolutely, yes. And they will not allow too much of research on this because this is an absolute essential in the Western countries. They need, every home needs this to cook. Otherwise, they can't cook the way we cook. But we have other ways of cooking. We don't need that. If at all you want to bake something, I would suggest use an OTG, but definitely not the microwave ovens. Doctor, do you want to add something to this?
Oh, fine. I fully agree with you. But I think we are slowly becoming so much dependent on microwave. Means you don't need to have matches or lighter or anything, and you just plug it on and the things are ready.
Sir, actually, the problem is something else, I feel. Now, if you order a pizza, or if you are getting a pizza for yourself, now actually you cannot heat it up on the gas, If you
that solves all the problems. No, that solves all the problems. You don't even have to eat pizza, right?
You don't eat pizza. Oh, yes.
It starts there.
Can we use the hot case like earlier in old times? We used to use hot case.
Sorry, I think we can.
Right. So we'll have some other questions a bit later. Dr. Priya, I can see her here. She was probably not able to unmute herself. Dr. Priya, over to you for a few minutes, please.
Hello, sir. So I think a very nice discussion from everybody, and I have been just given the responsibility to just tell few interesting facts about cancer, and so here I am. So I think it was briefly touched about immunotherapy, and I just want to expand slightly on that, because in the time of COVID, there's a lot of talk going on the body's immunity. See, body immunity is the first line of defense, not just for infections. Body immunity is the first line of defense also for cancers. HIV is one infection which causes immunosuppression, and patients of HIV are not just predisposed for infections, they're also predisposed for large
I think the immunity of the internet of Dr. Priya is not good. That is what probably I can guess, but certainly.
If you keep, sorry, the network issues from my side. What I was saying, if you keep working on ways of improving your body's immunity, you can definitely lower down your risk of cancers. And that includes all the measures, especially pointed out by Gauri madam. Exercising is definitely a part of it. And the newest concept to improve your lifestyle, metabolism, and your immunity is the intermittent fasting, and especially taking early dinner. So people talk about, yes, what to eat, but also important discussion at what time to eat. It has been shown, especially for two cancers, जैसे कि breast cancers and prostate cancer, that if you do an early dinner, so like we Indians have a habit of taking late dinner. So by early dinner, it means that if you are taking your dinner before 9 p.m. and at least 2 hours before the sleep time. Like many times people take dinner at 9 p.m. and they go to bed at 10 p.m. It has not to be like that. Okay, so take early dinner, like I used to take around 7 p.m. So early the dinner you take, it has been shown that it decreases your risk of cancer. So that is very important. You have to remember what to eat. You have to remember at what time to eat. And yes, exercise and physical activity is also very important. There is some role of yoga is also coming up. So that is one important thing, and the role of body immunity in cancer prevention. And that is why the whole idea about cancer immunotherapy. Cancer immunotherapy has actually revolutionized the anti-cancer treatment in the sense there were a lot of cancers like kidney cancers. There is a very dangerous skin cancer by the name of melanoma, where we don't have any kind of chemotherapy working. So patient used to come at very advanced stages and no treatment worked. But immunotherapy has actually changed the treatment outcomes. And I'm talking about stage 4 cancer. So that is stage 4, I think has been nicely explained. The cancer which has spread in the body, isn't it? The cancer which has gone from one organ to other organ. Okay. So for stage 4 kidney cancers, for stage 4 melanoma, and for stage 4 various standard of treatment. So, and which is actually changing. People are living long. We have patients who are getting cured in stage 4 cancers because of immunotherapy. Just last year, we had a few years back, we had a patient. He was kidney cancer stage 4, 28-year-old young male. Okay. We treated him with immunotherapy and he is doing well. And just last year, he got married also. So I'm talking about a stage 4 cancer. The role of body's immunity is very important. Lifestyle is very important. A frequent talk is why the cancer is rising. Because the cancer is rising, the simplest reason are the two ones, because of the rising population and because of the rising age. Cancer is predominantly a disease of old age. The more older people we will have, we have conquered infections, we have conquered a lot of diseases, people are living longer, and that is one of the important reasons that cancers, the incidence is increasing. To sum up all the risk factors of cancer, it has been nicely pointed out in the previous talk. But if you ask me, the risk factor for diabetes, risk factor for heart attack, the risk factor for stroke, and risk factors of cancers are essentially all overlapping. So that is why it's very important to take care of your health, because cancer, leaving apart few risk factors, are essentially is a disease of your altered metabolism. There are two very important facts to remember, that obesity also causes cancer. Yes, and India is going to become obesity capital of the world. And it is very important that we control our weight. How obesity causes cancer is because it again changes your metabolism. It causes release of certain molecules, what we call as inflammatory mediators, which put a lot of stress on the body, which in turn will affect your cells, causing them to degenerate, and that will propagate cancer. So it's very important that obesity should be curtailed. Food pipe cancer, kidney cancer, breast cancers, all these are very common in people who are obese. So obesity is a risk factor for many problems. It's also a risk factor for cancer. A very important note about vaccination. two important infection which cause, yes, infections also cause cancer. Two important infection cause cancer, and that is hepatitis B, which can cause liver cancer, and in females, human papilloma virus infection, which can cause cervical cancer. So if you are taking vaccinations, so hepatitis B vaccination, I am not sure anybody of you would have taken it, okay? But if hepatitis B vaccine you take, you are sure shot protected towards cancer caused by hepatitis B. We see a lot of people having hepatitis B, which infection, and then, they have this damaged liver where the liver cancer is very common. So I'll actually recommend the hepatitis B vaccination for everybody. Second is any female above the age group of 9 years should take HPV vaccination. There was a lot of talk about HPV vaccination some time back. But let me tell you, Australia is the first country which has actually eliminated cervical cancer from Australia, simply because they have vaccinated all females there. So, vaccination. So we're talking about cervical cancer. India contributes to maximum number of cervical cancer patients in the world, which is very unfortunate because it's a very much a preventable disease. So I think mammogram, etc. would have been talked about. There's something which is very latest, and I think this people should know. The treatment was very nicely summed up. Surgery is usually the mainstay of treatment wherever possible, and if surgery is not possible, sometimes the extent of disease is much, radiation therapy is done. Okay, so that we can burn the tumor. Sometimes after surgery also radiation therapy is done. Why? Because cancer has roots. So by surgery, we remove the tumors, but we want to take care of those roots so that cancer does not grow back. And that is why we give radiation. So why do we what is the role of chemotherapy? Chemotherapy is given so that it can control the disease. In the cases where surgery, radiation, all this treatment is not possible, mainly in the advanced stages. Okay, if somebody has a lot of disease in the body, you just can't operate everywhere, isn't it? So you want to give treatment which goes to all the sites. But sometimes even the patients who have undergone surgery or radiation, they can also come back with a recurrence because some cancer cells would have gone in the circulation. And that is why we give chemotherapy after surgery or sometimes with radiation so that we decrease those cancer cells. We take care of those cancer cells also so that the chance of cancer coming back is low. So a lot of other new treatment has come up. I think there was a discussion about hormonal therapy, targeted therapy, which are again latest in the list of anti-cancer therapy. And they are very specific targets to hit so that the toxicity of treatment goes down, which is always an important concern. There are few myths regarding cancers that should be abolished. First is cancer is incurable. That is not right statement. It depends upon the treatment, and the cure rate depends upon at what particular stage or the extent of disease patient is having. In the earlier stages, almost all patients are completely curable. That is the first thing. A lot of people think that India does not have the facilities or the ways to treat patients, which is again wrong, especially because a lot of celebrities go to foreign countries to get the treatment. Let me assure you, India is well equipped with treating all kinds of cancers. We also have facilities of clinical trials. People who tend to go foreign, I was told by one of them that one of the celebrities that it's because of the media, the privacy offered. So that is very important thing. So India has all kinds of good centers to treat all kinds of cancer. So from surgical expertise, you just heard about the robotic surgery, which is like, it is not available in many countries. So you have to be assured regarding that part also. So I think that will be all from my side. If you want to ask anything, I'll just tip in my suggestions as well.
Thank you. Thank you, Dr. Priya. You were really very clear, very simple, and you were very eloquent. I must say, I was thinking, because doctors speak very carefully. I have seen doctors communicating very softly. I see a lot of passion in you, Dr. Priya. May you continue to help all of us. Thank you. Dr. Diwan, if you allow, I have a question for you. Dr. Diwan is there, I think.
Yes, I'm there.
Sir, one question has come: how to avoid social isolation and depression, which is caused to the patient of cancer and to the family as well? If briefly you can, with your experience so much, if you can guide how to avoid social isolation and depression.
देखिए, cancer is not just a physical disease, and cancer is disease which affects you physically, emotionally, psychologically, and spiritually. And I think as oncologists, we probably address only the physical component of disease. So the caregivers, the family members, friends, they are the people who actually give the psychosocial support, maybe spiritual support, and the other aspects of care are given by you people, means the caregivers. बाकी सिर्फ फिजिकल मेंटल इन कंपोनेंट्स के अलावा जो फाइनेंशियल बर्डन पड़ता है, दैट इज ऑल्सो ग्रेट, एंड it hurts your pocket, it affects your family, and there's no easy solution for this, and we can't say that sarkar kar degi sab kuch. I think it is a joint venture. Cancer treatment is not just a problem of one doctor. It is the community level treatment which needs to be addressed at a multidisciplinary level.
Right, sir. Perfect. So, in fact, this takes me to the next question. What is the economical treatment? Is there anything available? Because it's so expensive for many people that they can't afford the treatment. Dr. Diwan?
Yes, yes. ऐसा है, गवर्नमेंट हॉस्पिटल्स में सारी ट्रीटमेंट्स फ्री हैं.
Okay.
Let it be AIMS, Safdarjung, Delhi State Cancer Institute, and some of the other hospitals who do the surgery. But exclusively cancer departments exist in these three hospitals. But the workload is so much, the cancer burden is so much. It is not only Delhi, they actually cater to the other states. And nobody can say no, कि मैं नहीं ट्रीट करूंगा, आप दिल्ली से बाहर के हो. तो सवाल आता है, the person is forced to go to the private hospital. I have seen prescriptions from AIMS, 7 months waiting for surgery. A person who goes there with stage 2 or stage 1 disease and will obviously become stage 4 disease and a terminal patient if he waits for that long. So I think government hospitals can't be blamed for that. We have limited resources in government hospitals, limited manpower, and people are forced to go to the private hospital. Now, private hospitals have got some or the other schemes, like Rajiv Gandhi Cancer Hospital. We have some, we spend, I think, more than 10% as a part of the corporate social responsibility and treat many patients free. We have many schemes which have been initiated by our board members that especially the economically weaker sections or few other criteria have been set up that they'll be treated free. But I agree with you that overall there is a financial burden. Even a rich person becomes a pauper at the end of the treatment. If he has to carry on with nicely elucidated treatments like, say, immunotherapy or targeted therapies, which are very, very expensive. It is an expensive treatment, and I think we have to accept.
Correct. Correct. Thank you, sir. Dr. Zaidi, I have a question for you. We talked about tests, we talked about vaccination. So what's the right age for this vaccination and how costly is this? And second, what test one can get it done every year? Like I go for every year, me and my wife go for this annual package of preventive health medical checkup. Now I don't know whether that's actually checking, and there is a test which can preempt whether there are any deficiency of cells or not deficiency, rather excessive cells or not. So which test and what vaccination and what cost? Dr. Zaidi?
The vaccination, you're talking about vaccination for cervical cancer.
That's the only vaccination. Yes,
Yeah,
sir.
yeah. So the vaccination should start early, especially in teenage age group, teenage girls, before they, before the exposure. So that is the right age. However, in case of delay because of any reason, the vaccine can be given up to the age of 35 to 40 years. Though as the age increases, the effectiveness reduces proportionately.
I see.
And talking about the screening tests, the screening tests are different in different countries based on the prevalence of cancer locally. In India, the common test which we do is number one is physical examination, which is most important. The patient is examined from head to toe, and after that some basic blood tests, which includes hemoglobin, liver, kidney function test, peripheral smear, then ultrasound of abdomen, X-ray of the chest. However, patients who are smokers, I think they should undergo, based on their affordability, low dose CT scan of the chest to pick up. In Western countries like Japan, America, they have a screening protocol for lung cancer. In America, they don't have a screening for lung cancer protocol, but they do for any patient who comes with a chest pain, even the slightest, mildest pain, undergoes a chest CT. So that is how they are able to pick up smaller lesions, lung cancer. And in Japan, they have a protocol for the entire population for screening. But in India, we do X-ray chest for the lung cancer. And we have a lot of tuberculosis. We are able to pick up a lot of tubercular cases also, plus lung cancer as well. But better is CT chest for those who are smokers, plus ultrasound abdomen. Some tumor markers like for men, prostate-specific antigen, mammography for ladies after age of 40 years or 35 to 40 years, less than 35 years of age. For those who have a family history of breast cancer, they should have ultrasound of the breast. Okay. That ultrasound as a screening for patients who have family history of breast cancer should start in girls 10 years, girls or ladies, 10 years younger than the age when patient developed cancer.
Perfect. We have
Stool for occult blood, and the digital rectal examination for prostate, and prostate should be done to detect rectal cancer and the prostate cancer. And occult blood, when occult blood means the blood cells in the blood, which can be detected by several methods. If the blood is present, then one must undergo colonoscopy and upper GI endoscopy.
Perfect. Dr. Zaidi, we will have to consult the doctor, and we should get this done. In fact, we had another event at 3 o'clock, and the platform is to be used there as well. We have few more questions. Maybe it is an indication that we need to organize such programs more often. And before we can plan for it, I can certainly say that the questions which have been sent by our members, if there are details available, we can in fact send these questions to Dr. Diwan and Dr. Priya. I'm sure they are always available, and they can guide our members whenever required. They have already taken out so much time. We have Satvinder ji to Mr. Satvinder Singh, our former Central Council member, and my mentor and partner, Vash Associates, to propose vote of thanks, formal vote of thanks. Sir, over to you.
Oh, thank you, NPS, for organizing, I think taking the initiative to organize this program. I think on the World Cancer Day, when thought occurred because the president's father passed away a few days back, and we lost our good friend who was a Central Council member, and Deepak. And suddenly it occurred that within period of 8 months, and he was rejected, and otherwise he was feeling very hot and healthy. And seeing all this thing, I think it prompted us to do a program on that cancer awareness on the World Cancer Day. And I must compliment the Institute for taking this initiative. I must thank Dr. A.K. Diwan, Dr. Shoaib Zaidi, Dr. Gauri Rokum, and Priya or agreeing to this. I must say that I am proud that I'm personally knowing Dr. A.K. Dewan and Shoaib Zadi. You see, we are brothers because Shoaib's sister is my Rakhi sister. So that's why, as and when any issue comes from this, and Dr. A.K. Dewan, because he's a real brother of my good friend for last over 30 years, Sanjay Dewan. So as and when any issue comes from any friends, relatives to ask for this, and I always look forward to them that okay to take any guidance, connecting them with the people, because I know the pain people suffer when they see that okay they have a cancer and they have been detected by the cancer. And the one of the topic which Dr. Shui has really touched upon, the psychological treatment also, apart from what we need to see. And Dr. Dewan, on that very mesmerizing exposition of your on that cancer, on that preventive measures, which you have put it to this, I think you have really taken up. And let me tell you, today I asked normally because we do a lot of sessions, and if I am a speaker, NPS is a speaker, and probably there is another, you see, speaking assignment to us at 3:30, which we have to attend. But before that, I'm just making it as, or particularly for this session, probably I asked my wife that, okay, you must listen. And I think, Gauri, the way you have taken it up, I'll see that, okay, how I can imbibe all those holistic nutritionists requirement to our life. And as Dr. Dewan has already, I think, stemmed, before you even had to speak, I think he stemmed your versions on this thing that, okay, you have to be, take a good sleep, stress. And I think the four logical points he said, that eat right, breathe right, weigh right, and live right. I think these are the four issues which really coordinate and you see put it to this. And I think the way Dr. Zadi, you had shown your presentation on this thing is the I think the diagnostic procedure, because we were just looking at it as when a person has a third degree or fourth degree and they are confused on it, what sort of treatment they have to go. And you have really touched about all the treatment options, be it the surgery or radiotherapy or the chemo or immunity therapy. And you have shown us that photographs. It really, I would say that when I was seeing those photographs, it was, I was feeling scary that, okay, that could be what sort of a fate one can have. And I think the prevention is always better than cure. I think that, and that preventive measures which Dr. Dewan and Gauri has really taken it up, mind-boggling. And the way I also compliment Priya for touching within a very limited time the immunity therapy which you have touched upon. It was really a great exposition by each of the panelists. And though I think I'll ask the members that, okay, we must pledge to ourselves that, okay, we have to do. And probably my only another way is that how the ICIC can coordinate with these hospitals, and we can give some good benefits to the members of this if we can tie up with these hospitals, because both Shoaib and Dr. A.K. Dewan and are really working in one of the best hospitals working on this, how best we can take their advantages. I think we can also look at it. But these are the important aspects of life to that extent. Today, my good friend had put a very important this that aspect on this that we need to be young, right, and live long as young. So I think that's a motto which we have to take it. Even if we get older, but we remain as a young and we die as a young, remaining as a older. That's the philosophy which we have to take it up for this. And I must thank on behalf of the ICSI for accepting our invitation at such a shorter notice. I know when NPS talked to me on, I think on 31st or 1st, that sir, the president has asked that we should organize some program, and I immediately reached to Dr. Diwan, Dr. Shoaib for this, and within no minutes, no brainer, he said, Satvinder, no, we will be there. And for taking out, I know the very tight schedule, the daily schedule they have, but despite this, and Gauri, Sharda ji's, I know Sharda ji's because she's part of my expert group on sector standard, which I'm chairing, and is this thing, and I know her personally to that how beautifully she work and the lifestyle she maintains. And thanks to Sharda ji also for connecting us, and to Priya for such a at a shorter notice joining us on this program. And NPS, if you have that, we normally have a Shaheed Ki Beti. If you can just coordinate with this, that would be of great help.
Yes, sir. Sure, sir. Thank you for such a nice vote of thanks. Dr. Diwan, presenting a Shaheed Ki Beti certificate, we have stopped giving trophies. Instead of that, we preserve that money and we give it to the daughters of martyrs. We have earlier presented checks to Ministry of Home Affairs. Here it goes. Dr. Diwan, thank you for being here. And this is the Shaheed Ki Beti certificate presented by Dr. Diwan. Thank you, sir. Would request Shaheed Ki Beti certificate to be presented to none other than Dr. Zaidi. Thank you, Dr. Zaidi, for being available to us, and I'm sure you will always continue to help us and our members. Thank you, Dr. Zaidi. Would request, thank you. Would request for presenting, and this is my personal request, Dr. Gauri, that while the Shaheed Ki Beti is being presented, here it goes. So it's for Dr. Gauri. I am sure that I am going to speak to you how I can at least have your diet plan and your holistic nutritionist treatment for few of the diseases which I am having, thyroid and vitiligo and so on and so forth, couple of them already. And to avoid entering into more dangerous diseases, I need to consult you. So thank you for being here. Would request.
But you start taking these tests, NPS. I think that's an important part. And sleep and stress, which you still carry, and I always look at it.
Yeah. Correct. Although he is my senior, but he never gives me neither stress nor he tells me to work sleeplessly. But it is our own bad pattern which induces it. Would request for presenting Shaheed Ki Beti certificate for our last panelist. Certainly not the least. For the shortest time, Dr. Priya spoke, but she was very effective. Dr. Priya, thank you for being here on a short notice. I know you were unfortunately earlier not able to join, but you agreed. Thank you for being here. Thank you, everyone. Thank you, Dr. Diwan. And I'm sure our members would have learnt a lot. Thanks a ton.
Thank you.